As I pilot my drone through the serene night sky, the glittering cityscape below inspires me to engage in a discussion about depression. From this elevated perspective, it's evident that the city's vibrant lights cast a stark contrast to the darkness that can envelop someone struggling with depression. Let's delve into the possible causes, treatments, and paths to recovery from depression. Causes of depression. Depression is a complex mental health condition with multifaceted origins. One possible cause is a chemical imbalance in the brain, involving neurotransmitters like serotonin and dopamine. However, it's important to understand that depression can also be triggered or exacerbated by external factors, such as 1. Life events. Traumatic experiences, major life changes, or prolonged stress can contribute to depression. Flying over the city reminds me that urban life can be incredibly demanding, with a constant hustle that can take its toll on mental well-being. 2. Genetics. A family history of depression can increase one's vulnerability to the condition, suggesting a genetic component. 3. Biological factors. Other biological factors, such as hormonal changes or chronic illnesses, can also play a role in depression. Treatment for depression. Navigating through the city's lights, I contemplate the various treatment options available for individuals dealing with depression. 1. Psychotherapy. Talk therapy, including cognitive behavioral therapy, CBT, and interpersonal therapy, can be highly effective in helping individuals identify and manage their depressive symptoms. Therapists provide a safe space for exploration and healing. 2. Medications. Antidepressant medications, like selective serotonin, reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, can help balance neurotransmitter levels in the brain. Proper medication management is crucial and often done in conjunction with therapy. 3. Lifestyle changes. Encouraging patients to adopt healthier lifestyles, including regular exercise, balanced nutrition, and sufficient sleep, can significantly improve mood and reduce depressive symptoms. 4. Social support. The city's bustling streets highlight the importance of a strong support network. Friends and family provide emotional assistance and can encourage individuals to seek professional help. Recovery from depression. As my drone climbs higher, I reflect on the path to recovery from depression, likening it to the drone's ascent into clearer skies. 1. Acceptance. Acknowledging and accepting one's depression is the first step towards recovery. It's essential to understand that it's not a sign of weakness, but rather a treatable medical condition. 2. Seeking help. Just as I navigate the drone through challenging weather, seeking professional help is crucial. Therapists and psychiatrists can provide guidance, helping individuals find the right treatment. 3. Treatment adherence. Like making adjustments to keep the drone steady, adhering to treatment plans, including therapy and medication, is vital for recovery. 4. Self-care. Individuals must prioritize self-care and make lifestyle changes to support their well-being. This may involve establishing healthy routines, maintaining social connections, and engaging in activities that bring joy. 5. Patience. Recovery from depression is not instantaneous. It requires patience and persistence, much like piloting a drone through the night sky. In conclusion, flying my drone over the city at night serves as a metaphor for the journey of depression, darkness pierced by moments of light. Understanding its possible causes, pursuing appropriate treatments, and embracing the path to recovery are essential steps in guiding individuals toward brighter horizons, just as my drone soars higher into the night.